Welcome to the deep dive. Okay, so navigating the Social Security Disability Process, SSD, it can feel like a whole other full-time job.
Oh, absolutely. It's a marathon, not a sprint.
Definitely. It often stretches for months, sometimes years. And through all that, managing your health, well, it isn't just about feeling okay personally. It's actually crucial, really crucial for your disability claim success.
That's the core of it.
So our mission today is basically to give you a shortcut. We're extracting the most potent strategies from a really comprehensive guide on managing health during this whole journey. We want to unpack those essential bits of knowledge to help you maintain your physical and mental health while, building a really strong case.
And that focus is so important. Understanding why managing your health well matters. It goes way beyond just personal well-being. The Social Security Administration, the SSA, they look really closely, meticulously even, at how consistent and severe your medical conditions are. So actively managing your health is not just a good idea, it's, strategic. It directly impacts how strong and believable your claim is. When that management slips, you see real problems. Gaps in treatment, for instance, that can weaken the claim significantly.
Yeah, I can see that.
Conditions might get worse when they maybe didn't need to. The stress ramps up, which makes health problems even worse. And then there's the financial hit from, say, avoidable ER visits.
Wow. Okay.
But on the flip side, if you show you're consistently managing your health, it shows you're committed to treatment. Plus, it provides that continuous documented evidence trail. And that's exactly what the SSA needs to see for a strong claim foundation.
Okay, so let's dive into one of probably the biggest hurdles people face, keeping up with medical care when money is just incredibly tight during that waiting game. How do you even begin to navigate that?
Yeah, it's a really tough one, but there are definitely strategies. First off, look into community health centers. These aren't just any clinics. They're often federally qualified centers. They usually offer sliding scale fees based on your income, which makes care much more affordable. And something people often miss is their integrated approach.
What do you mean by integrated?
Well, many offer primary care, mental health services, maybe even specialist referrals, all in one place. That kind of holistic record is great for the SSA because they look at your overall picture, not just one diagnosis.
That makes sense.
Second, don't forget about free and charitable clinics. They're often run by community groups or maybe religious organizations. They provide basic services, especially if you're uninsured.
Good to know.
Third, and this surprises people, most hospitals have financial assistance programs. They often have to offer charity care or payment plans if you're struggling financially. Always worth calling their financial counselor, proactively.
Definitely. Better to ask up front.
Exactly. And lastly, for prescriptions, which can be incredibly expensive, look into prescription assistance programs. Big pharma companies often have programs for free or reduced cost meds. And websites like Needy Meds can help you find them.
Those are some really vital resources, huge help for the immediate money barrier. But, okay, once you can access care, how do you make sure it's consistent the way the SSA needs to see it? How do you structure that?
Right. Structure is key. It's about proving ongoing need and that you're following through with treatment. So, first step, prioritize essential appointments, especially with specialists who deal directly with your disabling condition.
So not just any doctor visit.
Exactly.
Yeah.
People sometimes think any visit counts, but the SSA really wants to see consistent treatment for the condition you're claiming disability for. And a specialist notes on your functional limitations. That's gold.
Okay. Functional limitations. Got it.
Second, try to establish an ongoing primary care relationship. That gives you a consistent medical story, a sort of home base for your health care.
Makes sense.
Third, schedule regular checkups. Even if things feel stable, it documents the ongoing nature of your symptoms and limitations. Consistency again.
Right.
And fourth, really important, coordinate between all your different doctors. Make sure they're talking to each other, or at least you are telling them what the others are doing. Avoids conflicting treatments and makes your records look cohesive.
That roadmap, that structure, it really highlights how planning ahead can take off so much pressure. It's strategic documentation, like you said, not just showing up.
Precisely.
Okay, we've talked a lot about the physical care, the finances, the sort of tangible stuff, but our source really hammers home that the strain of the SSD process often hits mental well-being the hardest, and that, crucially, can loop back and affect your claim. How do you tackle those specific mental health stresses?
You're absolutely right. It's a huge factor, often overlooked. The SSD process itself creates unique stresses. Take information overwhelm. There's just so much paper, so many deadlines.
Yeah, it's daunting.
The best strategy,
break it down. Seriously, break the whole process into tiny, manageable steps. Make checklists. Create timelines. It helps you stay organized without feeling like you're drowning, which, by the way, can help prevent missing appointments because you're just burned out.
Okay, break it down. What about the money worries, the financial anxiety?
That's huge. Concrete strategies help. Make a detailed budget, even if it's painful. Look into emergency assistance programs we mentioned earlier, maybe even financial counseling from nonprofits. Taking action, any action, can reduce that feeling of helplessness.
Right, taking control where you can.
Exactly. And for managing the sheer uncertainty of it all, because let's face it, waiting is hard to say it just acknowledge what you can't control, like the exact timeline. But then bubble down your focus on what you can control, like sticking to your treatment plan, gathering your documents, following it politely on your claim.
Focus on the controllables.
Yeah.
Okay, so for someone already feeling stretched thin, what are the most accessible ways to build up some mental health support? Good question. There are several pathways. For professional mental health help, again, community mental health centers are a great resource. They often have sliding scale fees or take Medicaid, making therapy more reachable. And those therapy notes, they become crucial documented evidence of your mental health struggles and how they impact you.
Double benefit there. Evidence, too.
Definitely. Also, don't underestimate support groups. Connecting with other people going through the same thing, whether it's in person or online, can be incredibly validating, reduces that isolation, and you often get really practical tips too.
Shared experience helps a lot.
It really does. And finally, simple stress reduction techniques. Things like mindfulness meditation, deep breathing exercises, progressive muscle relaxation. Many are free, evidence-based, and you can find guided sessions online or maybe check local library resources. Doesn't require much money, just a bit of time.
It's so easy to just get bogged down in all the appointments, the forms, the waiting. That mental load itself is exhausting. So connecting this back, how absolutely critical is managing that mental stress for the whole application journey?
It's foundational, really. Unmanaged stress can directly worsen physical symptoms. Think about it. If you're highly stressed or depressed, are you more or less likely to make it to appointments or follow complex treatment plans?
Less likely for me.
Burnout becomes a real risk. Stress can also make it harder to think clearly and communicate effectively about your limitations during SSA interviews or filling out forms. That directly impacts how they understand your case. Plus, showing you're proactively managing your mental health, just like your physical health, demonstrates resilience. It shows you're doing everything you can, which subtly strengthens the overall narrative of your claim. It's all connected.
Okay, so that dual punch of less income and ongoing medical bills, it can just feel impossible. How can listeners proactively manage the financial stress around their health costs? Not just cope, but manage it in a way that actually supports the claim.
Yeah, proactive is the key word there. A really good starting point is to create a super detailed healthcare budget. First, actually list out and categorize all your medical expenses. What's absolutely essential versus maybe optional or deferrable. This helps you prioritize, and it also demonstrates that necessity to the SSA later.
Okay, categorizing helps focus.
Yes. Second, track every penny you spend on healthcare meticulously. Keep receipts, explanations of benefits, everything. Not only might some of it be tax deductible down the line, but these detailed records are powerful documentation for your disability claim, showing the real cost burden.
Right, proof of the cost.
And third, this is critical. Talk to your healthcare providers about payment plans proactively. Don't wait until you're getting collection notices. Most hospitals and clinics are willing to work with you if you communicate up front. It maintains good relationships and protects your credit a bit too.
That proactive communication seems key everywhere in this process.
It really is.
So beyond budgeting and payment plans, what other, maybe less obvious financial resources can help bridge that gap while you're waiting for SSD approval?
Definitely explore state and local assistance programs. Your state's Department of Social Services might have emergency funds or specific programs for people waiting on disability decisions. It varies state by state, but it's worth asking.
Okay, state level help.
Also, look into utility assistance programs. Things like LIHAPE, the Low-Income Home Energy Assistance Program, can slash your heating or cooling bills. That directly frees up money you can then use for copays or prescriptions.
Freeing up funds indirectly? Smart.
Exactly. And don't overlook food assistance like SNE benefits. Reducing your grocery bill significantly can make a huge difference in having enough money left over for those essential medical costs. Every bit helps.
So boiling down the answer to that big worry, how can I afford care? Beyond these programs, Asking providers directly about payment plans is a powerful step. It's about grabbing the reins where you can.
Precisely. Taking control.
Okay, now let's shift to documentation. You've mentioned it a few times, but our source calls it a truly strategic element. A game changer, actually, for both supporting the claim and just tracking your own health.
Absolutely. It serves both purposes incredibly well. Creating a detailed health journal is probably one of the most powerful things you can do.
Okay, what goes in it?
For daily symptom tracking, log your symptoms, your pain levels, use a consistent scale like 1 to 10 so you can see trends. And crucially, note your functional limitations every day. Don't just say back pain. Say back pain level 710 today. Couldn't bend to load the dishwasher. Had to lie down for an hour after sitting for 20 minutes. Specific, concrete examples are vital.
Got it. Real-world impact.
Exactly. Then, document your response to treatments. How are you reacting to that new medication, that physical therapy? Note improvements, sure, but also note side effects or things that aren't working.
Oh.
This helps your doctors adjust your plan, and it shows the SSA you're actively participating in treatment and trying things.
Makes sense. Shows you're trying.
And again, really focus on activity limitations. Document specific tasks you struggle with or can no longer do, work-related, household chores, social activities. Use those concrete examples. That's what helps the SSA understand how your condition limits you in a practical sense.
That's a ton of really important detail. So how do you keep all that, plus all the doctor's notes and test results, organized? How do you make it instantly useful for yourself and for the SSD claim?
Yeah, organization is non-negotiable here, or you'll drown in paper. Create a master file. Seriously, get a binder, an accordion file, whatever works for you. This is command central for your claim.
Okay, a master file.
Organize it logically. Maybe sections for each doctor, or chronologically by date, or by type of record test results, visit summaries, bills, whatever makes sense so you can find things fast.
Right.
Make it a habit to request copies of your records after every single appointment or test. Don't wait months. Many providers have online patient portals now, which makes this way easier. Use them.
Good tip. Use the portals.
And always prepare before your appointments. Bring your health journal, jot down specific questions you need answered. This makes each visit more productive, ensures you get the info you need, and helps you get the right documentation generated.
So really nailing down this documentation point, it's about being incredibly specific in that health journal, symptoms, pain, how it limits you daily, medication effects, all with examples.
Yes, specifics matter.
And for the records themselves, a master filing system, maybe sorted by doctor, kept up to date constantly by requesting records right away. It's about making your health journey totally clear and, well, undeniable.
You got it. Legible and undeniable.
Okay. Beyond managing information and costs, building strong support systems is just fundamental, isn't it? For practical help, sure, but also for that emotional resilience you need during this long haul.
Absolutely fundamental. Let's start with your family and friend networks. The key here is crystal clear communication. You need to actually explain your health challenges and what this whole SSD process involves. They can't read your mind.
True, assumptions don't help.
No. Help them understand how they can provide support that's actually helpful. And related to that, make specific support requests. Instead of just saying, I need help, try, could you possibly drive me to my doctor's appointment next Tuesday? Or could you help me sort through this pile of medical bills for an hour? People respond better to specifics.
Makes sense. Gives them a concrete task.
Exactly. And also, crucially, practice boundary setting. Be clear, kindly but firmly about your energy levels and what you can and can't commit to. Overextending yourself will only hurt your health and potentially your claim if you start missing things. Protect your energy.
Setting boundaries is key. Okay, what about professional support networks? Who can really help ease the burden and stress here?
Equally vital. First, focus on healthcare team coordination. Build good relationships with your doctors and therapists. Ideally, find providers who understand a bit about the SSD process or are at least willing to provide detailed documentation. You want everyone on the same page, working together.
A coordinated team.
Yes. Second, strongly consider legal support. An experienced SSD attorney knows the system inside and out. They can handle the paperwork, the appeals, the communication with SSA, freeing you up to focus on your health.
But lawyers are expensive, right?
Many SSD attorneys work on contingency fees, meaning they only get paid if you win your case, usually a percentage of your back pay. So there's often no upfront cost, which is huge when money is tight.
Contingency fees. That's important.
Very. Lastly, look into case management services. Some community organizations or even insurance plans offer case managers who can help coordinate all sorts of things. Healthcare appointments, social services, transportation. They can lift a huge administrative weight off your shoulders.
So these networks, personal and professional, they do more than just practical stuff like rides or paperwork. They're vital for your emotional well-being, which, as we keep saying, ties directly back to your physical health during this super stressful time. It really is a whole person approach needed.
Exactly, a holistic approach to navigating the system.
Okay, finally, let's talk about lifestyle modifications. Our source highlights these as key for managing symptoms, preventing things from getting worse, and also, interestingly, showing your commitment to your health.
Yes, demonstrating that commitment is part of the picture for the SSA. Let's start with physical activity adaptation. This doesn't mean running marathons. It means working with your doctors or physical therapist to find safe, appropriate ways to move your body.
Even small things.
Absolutely. Even gentle chair exercises, short walks if possible, specific stretches. Anything tailored to your condition shows you're trying to maintain function within your limits. It's about proactive management.
Okay.
Then there are energy conservation techniques. This is huge for many chronic conditions. Learning how to pace yourself through the day, breaking big tasks into smaller chunks, scheduling rest periods, maybe during times your energy dips. It's about working smarter, not harder, with limited energy.
Pacing, that sounds crucial.
It is. And also, think about ergonomic adjustments in your home. Is your chair supportive? Is the lighting okay? Do you need any simple aids to make daily tasks easier, like grab bars or tools with thicker handles? Small changes can reduce strain and support your documented limitations.
Makes sense. Modifying the environment. What about things like nutrition and just general wellness habits, especially when budgets are tight?
Still critically important. For budget-friendly nutrition, focus on affordable, nutrient-dense foods. Think beans, lentils, eggs, frozen vegetables, whole grains. Plan meals. And don't hesitate to use resources like food banks or SNP, as we mentioned, to stretch that food budget.
Oh.
Good nutrition supports overall health.
Right. Fueling the body well matters.
Definitely. For medication management, consistency is paramount. Use pill organizers, set phone reminders, whatever system works for you to take meds as prescribed. Gaps in medication adherence can really hurt both your health and your claims credibility.
So systems for meds are key.
Yes. And finally, don't neglect sleep hygiene. Establish a regular sleep schedule as much as possible. Make your bedroom dark and quiet. Poor sleep worsens pain, fatigue, mood, cognitive function, basically everything that impacts your disability and your ability to cope. Good sleep is foundational.
So these aren't just like nice to have. They're really essential tools for managing day-to-day symptoms and showing you're actively participating in your health journey throughout this whole process.
Exactly. Essential tools for self-management and documentation.
Okay, let's pivot slightly to one of the most critical proactive strategies.
Yeah.
Actively working to prevent your health from getting worse while you wait. Staying ahead of potential problems.
Yes, this is about playing defense for your health. Building resilience. So for early intervention strategies, you need to get good at symptom monitoring. Learn to recognize the early warning signs that your condition might be flaring up or that a new issue is starting.
Catching things early.
Right. Catching something small before it becomes a major crisis can prevent hospitalizations, disruptions in treatment, and setbacks in your claim. Prompt action matters. Also, keep up with preventive care maintenance as much as possible. Annual physicals, recommended screenings, vaccinations. Many community clinics offer these at reduced cost. Preventing new problems is easier than treating them.
Good point. Prevent what you can.
And circling back again, medication compliance. Sticking to your medication schedule consistently is vital for preventing deterioration. If you're having trouble affording meds or dealing with side effects, talk to your doctor immediately. Don't just stop taking them. That lack of compliance can unfortunately be viewed negatively by the SSA.
So communicate problems with meds right away.
Okay. And what about planning for those worst-case scenarios?
Yeah.
Potential health crises? How do you prepare to minimize disruption to your life and your claim? Having a plan B, or even C, is smart. Develop emergency action plans. What do you do if you have a sudden severe flare-up? Who do you call? Have a sheet ready with emergency contacts, your current medication list, including dosages, allergies, and your preferred hospital. Keep it handy, maybe on the fridge or in your wallet. It reduces panic and ensures faster, appropriate care if something happens.
Like a go bag for health emergencies.
Sort of, yeah. Also, think about financial emergency planning specifically for unexpected medical costs. Do you know which local hospitals have robust financial aid? Do you have a small emergency fund? Even just a tiny one? Knowing the procedure for payment arrangements before you need them can help.
Preparing financially for the unexpected.
Yes. And establish clear communication protocols with your main doctors for urgent issues. How do you reach them after hours if needed? Knowing the process beforehand ensures you can get guidance quickly and maintain that documented continuity of care even during a crisis.
So, summing up these really crucial points, if your health does worsen during the SSD wait, the absolute key is consistent medical treatment, documenting all the changes meticulously, and telling your doctors right away.
Immediately, don't wait.
And that common question, how often should I see my doctors? The advice is stick to the schedule they recommend for your specific conditions, often every 3 to 6 months, for chronic stuff, because that steady, consistent engagement is what really bolsters your claim.
Consistency is the name of the game.
Okay, wow. We have covered a lot of ground. 7 essential, really strategic approaches for managing your health during the whole SSD process. We've hit home how these are just vital for your own well-being day to day, but also absolutely critical for strengthening that disability claim.
They really go hand in hand.
For those of you listening who want to maybe explore even further, our source material did point to some great additional resources. Apparently, there are visual health management strategies out there in video formats might be helpful for different learning styles.
Yeah, seeing things visually can click sometimes.
And for more perspectives, there's mention of a podcast that features healthcare professionals, people who've successfully gone through the SSD process, and experienced disability attorneys. So hearing those different voices could be really valuable.
Hearing from people who've been there, definitely.
And the source also mentions some essential reading, like an article specifically on the importance of consistent medical treatment for SSD claims. Really digging into how your health management directly impacts claim success, explaining specific documentation needs and medical evidence strategies. Worth seeking out if you want the nitty-gritty.
Absolutely. Understanding the why behind the SSA's focus on consistency is powerful.
So wrapping this up, what's the final thought you'd leave our listeners with?
Well, if we connect all this back to the bigger picture, these health management strategies we've talked about, they aren't just about ticking boxes for a bureaucratic process, They are, fundamentally, a profound act of self-advocacy.
Self-advocacy. I like that.
Yeah. By meticulously managing your health, by documenting your journey carefully, by building those support systems, you're really empowering yourself. You're not only building the strongest possible foundation for your disability claim, but you're also proactively taking control of your own well-being. You're fostering a resilience that, honestly, will serve you long after the claim itself is decided. It's about taking back some power in a situation that can feel very powerless.